Hey guys, I'm getting some questions about this new H5N9 outbreak in the US. So H5N9 is a different type of bird flu. It is a highly pathogenic avian influenza, which means that it can make birds very sick, but it's not necessarily a type of bird flu that more easily will transmit to humans or will cause more severe human disease. So in that sense, it's not a particular concern. We definitely need to observe what happens with this outbreak. The bigger concern remains the bird flu that we've been talking about for months now, which is the H5N1 that has affected cows, that has affected 67 people in the United States, where we've had 2 severe cases in the US. One of those people have died, and 1 severe case in Canada. Again, as far as we know, there is no human-to-human transmission of this H5N1 bird flu, but there are some warning signs, including the fact that there are a couple of cases in the US where there was no known contact with animals, so there's a question mark as to how those people got it. And there's one such case in Canada, which is that young girl in British Columbia who got really sick from this and ended up in the ICU, thankfully has gotten out of the ICU and recovered, but we also don't know how that young girl contracted the virus. So it's an evolving story. We're still learning more about this virus. Thankfully, most of the people who have gotten it have not gotten very sick from it. Thankfully, there's no clear evidence of human-to-human transmission, but it's something that needs very close monitoring. We need more sequencing. We need more testing. We should have wastewater testing. We really need an understanding of where this virus is, how fast it's spreading, and how fast it's mutating. And unfortunately, with what's happening in the US, with the US pulling out of the World Health Organization, and with RFK Jr. potentially about to be confirmed, there's a lot of concern about whether the US will take this seriously, will fund the kinds of activities that we need to monitor things like this and to be able to control this if it does become more of a threat. So this is a very tricky and somewhat scary time for the whole world because of that critical leadership role that the US plays in helping to identify these kinds of pathogens and ultimately to control them and to prevent future pandemics.